So good morning, everybody. I'm Pam Garant. I'm on Lakeville Fire Department, newly appointed lieutenant. In the crowd, we have Deputy Chief William Purcell, and we have Chief Mike O'Brien. So today I've been asked to talk to you about patient rights and transportation rights. And we're not talking in a Rolls Royce. We're talking, we're talking the boo-boo bus. So the three things that we're going to talk to you today: elder rights, the right to refuse treatment, and also some hospital destinations. And I use the word elders as a term of respect. It's not a derogatory term. I tell my kids, respect your elders. I include myself in that term. So elder patient rights. This is some of the basic rights that you have at all times, and anytime you're with a caregiver, you should demand to be treated this way. You have the right to receive appropriate medical care, and it doesn't matter your age, your race, your religion, or your national heritage. You have the right to be treated with dignity and to respect, and we're going to respect your individuality and your preferences. You're going to have the right to be free from physical, verbal, sexual, and mental abuse. You have the right to be treated with respect, dignity, and we're not going to neglect you or involuntarily seclude you. And this is my favorite: you have the right to be transported in a clean and properly maintained ambulance, which is in compliance with all the rules and regulations. And I say it's my favorite because it doesn't matter. In the winter, it's kind of hard to keep the outside clean, but I insist the inside always got to be cleaned. So some more rights: you have the right to be informed of the need to be taken to a medical facility, and it's capable of giving you appropriate care. We're not just going to take you and put you in the ambulance and not tell you. You need to be informed of this decision. You have the right to autonomy, and you have the right to self-determination in respect with your choices. So this means you have the right to decide what you want to do with your own body. And the last right up there is the privacy right, the HIPAA rule. So we're not allowed to give your information to anybody else. And sometimes it's hard because a caregiver or a relative will come in and say, I need that PCR, and I say, can't give it to you unless we have expressed written consent from the person that was transported. So any questions on that so far?
Yeah, when you have a HIPAA form, or like in your doctor's office and everything, they always ask, who may we release the information to? Do you people use that document, or it's a...
The HIPAA document, it's the same document.
So you could call my doctor's office?
But we do not release it to anybody without your permission.
How can you give it if you've been picked up in the ambulance and taken somewhere because you're sick?
Well, some of the ambulance, we used to keep copies of them, a hard copy, and then with your PCR, we hand it to you. But everybody, whether you have that or not, remember you have that right to privacy, and we respect that right to privacy. So suffice it to say, I'm not going to give your information to anybody. This...
I'm just thinking, if you pick me up in an ambulance and you rush me to a hospital and I'm not capable of doing anything at that point, my family trails along behind and they dash in, where is she, how is she? You won't tell them anything?
Oh, well, we can't tell them. If they already know that you're coming, obviously within reason, we're taking your mom, she's going to the hospital. We would say that we'll say she's in good hands, we're going to bring her to the hospital, and then when you're in the hospital and you're with them, yeah, this is my daughter, you can talk to her. But if you're not communicating, obviously. We do have to be sensitive about information. Some families, you know, I've had people say, "Don't tell my father," and they're a legal adult, 22 years old. Don't tell my parents I've been in an accident, and that's hard because I'm a mom and I would want to know if my kid was in an accident. But they're over 18, they know who they are, they know where they are, so we have to kind of balance on that.
So it will be, don't bother you, go right to the medical people in the hospital to try and find that information.
And they would say the same thing. They need to have your permission. But
But if
obviously,
they have the form, they have my HIPAA form.
That probably, we'll talk a little bit later on, but that would come under advanced directives. And you can, at any time, write orders that says, if I'm ever incapacitated, my daughter Linda is allowed to make decisions for me. And we, at that point, if you're incapacitated, we would say, okay, Linda, your mom's going to the Good Samaritan Hospital. We think she has a problem with her heart, and that's called advanced directives.
Mm-hmm. What about the file of life? Does that?
We're going to talk about that.
But does it have a section there as to who you could give information to?
I'll address
sorry,
that in a few. Don't steal my line. So, in part of what we talked about, self-autonomy, you get to decide what you want to do with your body. You can also decide what you don't want us to do. So we're there to help you. We're not there to bully you. We're not to force you to do something that you don't want to do. You have the right to refuse treatment. Hey, I just wanted you to come here and help me up. I don't want to go to the hospital, but we think it's in your best interest. Oh, I don't want to go. You know who you are. You know where you are. We're not going to force you. So part of that also, you have to have informed consent. You have to have competency, which means you're your own person. You are alert. You're oriented. You know who you are, where you are, and the events that are going on. And you have to have the capacity to make a good decision. So we're going to touch on this legal stuff in a minute. So the first part, informed consent. Does the patient have sufficient information regarding their current medical condition? And I say current because they may say, oh, I broke my leg in 2014. Okay, well now there's a different, you're having tingling and numbness down your leg. And do they have the ability to understand the situation? So that's informed consent. Competency, like we touched a little bit on earlier, it establishes that the patient is their own decision maker. It means that they are free of any cognitive impairment. They don't have dementia. They don't have a traumatic brain injury. And it means that they understand what's the benefit of going to the hospital and your pre-hospital care, and also what are the risks for refusing. So as long as you are sound mind and body and capable of making informed decisions, you have the freedom to decide what you want and what you don't want. I've gone to somebody's house before and they say, I know I need to go to the hospital. I don't want an IV. I respect that opinion. So I figure it's better for them to go in the hospital, safe, transported, and if they don't want an IV, they don't get an IV. It's like I said before, it's considered unethical to force somebody, to trick them, to coerce them in any way, shape, or form. We can't scoop you up out of bed and say you're going to the hospital. Doesn't matter if a relative says, take my mother. She's been driving me nuts. She's sick. She won't go. We're there. We want to help. But if mom knows who she is, where she is, and she said, I know I'm sick. I don't want to go. Or she says, I want to go, but don't put anything on me, or I don't want oxygen. The benefit of going to the hospital is better than treating them 100%. They have the right to choose what they want. If we forced somebody, so say I take my friend, what's your name?
Eleanor.
Eleanor, you're coming with me. You're going to the hospital. You don't want to go. No. Doesn't matter. You're coming. You're coming.
You can't do that.
That's assault and battery. And so we could be charged with a crime for taking you against your will. I'd rather stay and, have coffee and tea with Miss Eleanor, but so I'm going to stay on your good side. And so the last component of the right to refuse treatment is called capacity. Now, you can be competent, alert, and oriented times 3, and your capacity can be changed. How this happens, say you fell, you hit your head. You normally know who you are, where you are, but you're a little bit impaired. Same thing if you had alcohol. So in certain instances, if you had a blood alcohol of 0.08 in Massachusetts, that's considered legally impaired to drive in Massachusetts. We're not going to give you a ticket. But we may take that under advisement if you have the right to refuse treatment. So somebody could have a glass of wine and they're like, yeah, I had a glass of wine with dinner, but I was putting the dishes away and the knife cut me and I think I'm going to need a stitch. I don't know if I need to go or not. If they really didn't want to go, even though they had one glass of wine, they're acting appropriate, they're not slurring their words, you know, they could refuse that treatment. If they were like stumbling and saying, I'm not going, we would take that under consideration as well. We don't judge people, we just try to work in their best interest. And so if we feel that the patient judgment is impaired, then we need to make decisions for them in their best interest. So sometimes if somebody had a UTI, that's a urinary tract infection, that can, you know, can be sweet lady, normally knows who she is, where she is, but sometimes UTIs make people loopy. And when you're loopy, you don't make the best decision. So we're there to assist you. We respect your rights. And if you are competent, you have capacity, and you are informed, and you have a condition, we think you should go to the hospital, you say, nope, I'm not going. You're not doing it because you're suicidal and you want to die. You're doing it. I genuinely do not want to go to the hospital. You can't make me go to the hospital. If I have a problem, I'll call my son-in-law. He's a doctor in Florida. That's a complicated refusal. And sometimes what the EMS provider will do is we will call medical control and we will get on with the doctor. And we will directly have the doctor talk to you. And the doctor, he'll ask us some questions. He may ask, what are your vital signs? What's your blood pressure? How are you presenting? If we did any other treatment, if we took a blood sugar or something. And the patient may say, no, I know I'm sick. I don't want to go to the hospital. I've had a bad experience. And then the doctor talks to us again and says, okay, they have the right to decide to not be transported. That's called a high-risk refusal. And a lot of times we will advise people, if you change your mind, if you decide after you sign this that you want evaluation, if you want treatment, or if you want transport, we will 100% come back. So keep that in mind as well. And a lot of times, okay, if you don't want to come with us and you don't want to go to the hospital, is there somebody that could stay with you? You know, do you have a friend? Do you have a relative? And sometimes they're like, yep, my friend Nancy's down the street. She's a nurse. She'll come and take. We feel a little better. Like, it's always hard because you want to take care of people. So, sometimes you have to respect their right to make that decision, you know. So is everybody good with that? You too, Miss Eleanor? I'm not going to force you. So there's a couple other things that we take in consideration, and this is a little bit what we were talking about with the healthcare proxy. So if you're ever incapacitated, I designate this person to make decisions for you. And now the first one up here, this is a MOLST form. You probably heard of something called a DNR. And so the MOLST form is a more comprehensive form, and it's kind of taking over the DNR. DNR just says, do not resuscitate. If there ever was a cardiac arrest, I don't want CPR done. I don't want anything done. And the MOLST form is a medical order life-sustaining treatment form. And in that, you can be very specific with your wishes. If I ever become injured, I don't want an IV. I don't want a breathing tube. We call that intubation. I don't want to have parental nutrition. I don't want a feeding tube. Some people are even, it's called DNR, do not hospitalize. But we would still go, we could help you, we could do what you want. And the thing we look for is the form valid. Is the name on there? The date of birth on there? Is there a patient signature? Is there a doctor's signature? Now, if you sign that, does not mean it stands in stone. You can say, you know what? I changed my mind. I want to be treated. I want to be transported. And as once you do that, it's null and void. So, and you can talk to your doctors and ask if you would like a medical order, life-sustaining treatment, the MOST form. Usually they're pink.
So this is a new form?
Relatively new, over the last couple of years.
Okay.
Now, you need a medical professional sign off for the form?
Yes, you do. You need a physician's signature.
So it has to be a doctor?
Mm-hmm.
And
Has to be a doctor. So, hospital destinations, that's the third part of our talk today.
Skipped over healthcare policy.
You know what? That's
What is the value of that under these photos?
that's like Eleanor was saying. You can legally appoint somebody.
I have all of that, so would that cover if I collapse somewhere and they pick me up?
Yeah, and you know what I say? If you have that form and it's somewhere in a safe and nobody knows where it is, it does you no good. If you have a MOST form, if you have a healthcare proxy, make a copy. Keep it on your bed. Keep a copy in your file of life. Keep a copy with your daughter or your son or your neighbor, and so it's visible. Keep a copy in your glove box, and then that way it's there. Because if we can't find it, we have to assume there isn't one. And so we will then do everything within our power to provide care for that person. And honestly, you know, it's hard to talk about DNRs and MOST forms. It's a delicate subject. Nobody wants to think about that. But it's a blessing in some ways to talk about this with your family before. Then they can respect your wishes. In my instance, my mom had breast cancer. And it was tough in the beginning, but I had to say, Mom, should something happen, what do you want with your body? And so we did that, and she decided that she did not want to have heroic measures done. So I kept a copy. My sister kept a copy, and when the time came, it was easier for us because we were respecting her wishes, you know. And sometimes, if somebody collapses, and maybe they didn't want to be, you know, revived, and they end up with a tube in their throat. Now the family has the hardship of deciding, I have to take them off life support. Whereas if Mother Nature kind of, you know, if it's never easy, the death of a loved one. But if it happened in a natural setting, you can almost justify that in your brain a little better than having the guilt of saying, should I have taken them off life support or not? You feel a burden on that decision. So if you have any questions about that, I'm sure your healthcare provider could talk to you about that a little more.
I'm asking all these questions.
So hospital destinations, where we transport to and why. So what is an appropriate healthcare facility? An appropriate healthcare facility is one that geographically would be the closest to your current location, not to where your house is, but to where you are at that specific point in time. And there's an approved Massachusetts point of entry plan. And that means for certain conditions, such as a stroke, such as a heart attack, that we would bring you to that appropriate hospital. Even if it wasn't the closest geographically, say I'm having a stroke and this hospital is a mile away and a stroke facility is 3 miles away, we're going to bring you to the 3-mile one because they can handle your condition. You're pretty fortunate in Lakeville because you have a lot of choices. So we base it on certain criteria. Is there an immediate life threat? Are they in cardiac arrest? Is there an uncontrolled airway? There's physiologic criteria. This GCS is the Glasgow Coma Scale. That tells us, how somebody is mentating. What are their vital signs? Is there any traumatic injury? Also, we take into consideration mechanism of injury. Say somebody was in a car accident, and if there was ejection, if there was death in that same compartment, that would elevate it to, we would want to go to a trauma facility.
Can you go further in, you said that here in Lakeville we have many choices about hospitals. Could you expand on that?
Yes, good question. So I'll get to the specific choices that you have, but some of our considerations: is the patient older than 55? Are they on dialysis? And do they need end-stage renal disease requiring dialysis? Do they have a burn? They would need to go to a special facility. Anybody on anticoagulation meds, Coumadin, Eliquis, and sometimes EMS provider judgment would be a special case. So you have the right to participate in your decision-making process. And we will transport you to the hospital that you want to go within reason. Here are the hospitals that we transport to. We go to Morton Hospital in Taunton. We go to St. Luke's Hospital in New Bedford. We'll transport to Charlton Memorial in Fall River, St. Anne's in Fall River, Toby Hospital in Wareham. The BIDP, the Beth Israel Deaconess in Plymouth, used to be called the Jordan. Brockton Hospital in certain instances. Good Samaritan in Rhode Island are our trauma facilities. Good Samaritan is a trauma level 3, and a level 1 trauma center is Rhode Island Hospital that's in Providence. So we need to judge in our decision-making process. If you're having a heart attack, Morton's closer, but if we see something on your EKG, they can't fix that. They can't do what's called PCI at that hospital. But if somebody was having a stroke, Morton is a stroke facility, so then that would be a good choice. And so we have to know what are our point of entry protocols, and ultimately we need to respect your wishes. Okay, look, Charlton Hospital and BI, they're equidistant from where you are. But you have a prior relationship and all your records are at BI, then BI would be more appropriate. Do you understand that? So you have the right within reason to do that. And that basically means that you have to be everything that we said: informed, have capacity, and then make the best decision.
To Good Samaritan if it's a trauma?
Nope, they are a trauma facility, but we can take them for anything. If you have a prior relationship with them and you have nausea, vomiting, we can bring you there. If somebody was having a heart attack, we could bring you there. They just happen to have a higher level of surgeons available at certain time frame to designate that, and they're pretty good with what they're capable of doing. They're not a level 1 trauma center, but they're really good.
Where do you take people for a heart attack? You said not what?
So that would be a cardiac facility, and I can talk in layman's terms too. So if somebody's having a heart attack and we put them on our monitor, and we see certain criteria as to their heart rhythm, and we're going to say, we think there's a high chance that there's a blockage. And the hospital's got to do their roto-rooter thing to unblock it. So Good Samaritan can do that. Charlton can do that. BI can do that. Obviously, Rhode Island can do that. There's certain hospitals, you know, that are capable of fixing it, and that's not doesn't mean that the hospital isn't a good hospital because they don't do that. It just means for whatever reason they don't have that staffing to have that certain designation. I used to work up in the Milford area. Milford Hospital is a great hospital. They could do cardiac catheterizations on a schedule, but they couldn't do it emergently. So we would have to then bring them to UMass. So if somebody was having a heart attack, they could go to Morton, but then if they have to fix it, they would have to be transferred. So does everybody understand that?
The cost of that. If you have to take them someplace further away from what? Are you charged for doing that?
I am not sure. I would have to get back to you on that. I'm focused on the patient and patient care. I'm not really an expert on the billing. I would have to get back to you. I know if cost was a concern, we would work with the patient, I'm sure. And I know from talking to some of the other lieutenants in the past, if there was a financial hardship, we would try to make an abatement. So we do some other things. We do some community outreach things. And the purpose of that, we want to cultivate community relationships. We want to meet you. I want to sit and have tea with Eleanor. And what was your name? Mary. Mary, like we could go get our nails done. Like, and what's your name?
Charles.
Charles, do you fish?
No.
What do you do? See, we want to learn these things, you know, and the more we know about you, you know, that it makes a nice relationship because you've got some great questions, and I appreciate that. So what we want to improve public safety, that's the end goal. You know, we want to see what are your concerns, how can we work to reduce those concerns, and we can do fire and life safety education. Deputy Chief Purcell's, he's an expert on that. We inspect smoke and carbon monoxide detectors. We've had some of my colleagues have gone to houses and they've actually installed them for people. We change the batteries if you need help. We do a lot of things like that. We also do a program where we can try to mitigate falls. And again, Deputy Chief Purcell, he's been at the forefront over years and years of doing this with people. And so we give people tips. You know, how do we prevent falls? All right, well, we're gonna stay fit. We're gonna put a night light. Did you have a question? We're gonna put a night light between the bedroom and the bathroom to illuminate your path. Area rugs are the bane of our existence because you're walking from one level surface onto another, and if they don't have that rubber backing on it, swoop, down you go. So also electrical cords, we try to make sure that they're not any obstacles obstructing your pathway, or if you know there's one and there's no other way about, maybe put duct tape over it. But you want to try to remove any kind of tripping hazard. And like you said, Deputy Chief Purcell will come and he will talk to your crowd. He's got some great pictures and stuff that he can do. But basically clear the way. Look out for stuff on stairways. Make sure the path is clear. And we have the file of life. And I actually have some that I can give you. If you want to pass these around, we'll put some there and send them. Traditionally, you put these on your refrigerator.
No, I don't.
You fill it out. You can keep your med list up to date. I like these because when something happens, You're not in the right state of mind. You get nervous. Wait, I know she takes 3 medicines. I don't know what they are. I know she has an allergy, but I can't think of what that is. And now I don't know about you, but I have big printing, and it would never fit on this. But if you take a piece of paper, fold it, and you put it in here, that helps us. The quicker we can get information in and out, the better we can help you. I had a call recently, and somebody had a med list. They kept it in their wallet. That is a great tool. If you don't remember what your meds are on, type them out. Write your name, your date, your allergies. I keep it in my wallet from my dad. So you don't have to try to fit in this. And the medical insurance information, that's the least of our worries. I wouldn't even bother putting that on there. Put your medical history. My husband has a history of atrial fibrillation, AFib on Coumadin. Boom. That's good information for us. Because sometimes we may see something on the monitor and, ooh, that's different. But wait, no, that's what he always has. Or she has low blood pressure. So now if we see a low number, oh, that's her normal. You know, that's helpful information. So like I said, type it up on a piece of paper, fold it, stick it in there, put it on your fridge. And while you're at it, make a copy, throw that in your glove box too. Because that always happens. I know I'm on a med, I can't think of the name, or it's a good thing to do. So some other things that we do, you can call the fire department and check on the welfare of a patient. We can check a blood pressure. I have a couple people that I've adopted as my extended family that want regularly want me to, and I made a chart, blood pressure, check it, every couple days. If somebody fell and they're not hurt, but you're not strong enough to pick up your husband, and you risk getting hurt, we'll come and help you. Don't risk 2 injuries. And the biggest thing on that is if we do any of these, you're not going to get a bill. Don't worry about that. You're not obligated to go to the hospital. I take Mary's blood pressure. That's a community outreach service. I help you move from the bedroom into your chair. We're not going to charge you for that as long as you're not transported. You're not going to get a bill for that. If you are transported and you are worried about a bill, we've worked with people before to try to get an abatement. And if you got a bill in the past, I am not even going to know about that. Nobody's going to be aware of that. We never, ever refuse transport for bills. Never. You call us every time, we're going to come there. We don't check that stuff.
Doesn't Medicare cover that?
Medicare traditionally does. Like I said, I'm not a billing expert in any way, shape, or form. I'm a people person. I'm not a number cruncher or anything like that. You call, I'm going to help you. Plain and simple. So just
to have any of those first ones, is it okay to dial 911?
So we have a business line, and it's on our website, correct, Chief? So 508-947-4121. That's the business line.
Okay.
If there's any question, she fell, I don't know if I'm going to need an ambulance or not, call 911. We'll start the process. But if you know, hey, you know what, my sister Edna is coming, and she's a diabetic, and I know she's not going to the doctors, and can we just, take her blood pressure? No problem. will come over and take her blood pressure. Or I've had people come to the fire station
You can do
and they walk in. Now, so we may be on a call, so there's sometimes if you want to do that, call and say, hey, can I come in later on and do that? I have no problem. I have no problem doing that. I'm more than happy to help you, and I know a lot of my coworkers are as well. So in closing remarks, I am channeling my inner mom. We always strive to follow the golden rule. So I always want to treat you as I would want to be treated. And so if it's cold out, I want to make sure, you know what? That paramedic gave me a blanket. You know what? That paramedic took the time to say what my problem is and explain to me the process. You know, you should not be yelled at. You should not be treated with disrespect. You know, nobody wants to be hurt. Nobody wants to be sick. It's not your fault that you fell. Be treated as you would want to be treated. So that's it. Does anybody have any more questions?
Today, I just want to make sure that everybody has seen or completed one of these forms. Basically, it's a voluntary program where you fill out this form and you bring it back to here at the COA, and all your information is added to a database. And so in an event of an emergency, the police and the fire department have access to that information as well. So it's just one more layer of protection for you. Okay, so please make sure that if you don't have this completed already, that you grab one and do that. It's just one more thing to help you out. I want to say thank you to Lieutenant Pam Garant. This is her second day as lieutenant, and I think you guys can understand or figure out pretty quickly why she was promoted. She's a very bright lady. We at the Lakeville Fire Department, when we promote somebody like her, it's because we want to do a better job. It's not because I like Pam and I want to get her a better paying job. It's because she does her job well. And our job is to serve you. So events like today and anything we do in the future, it's all to help you, do a better job of serving you. If there's ever anything that you can communicate back to us to help us do that, we're all ears. This is a positive thing. It's all about taking care of you and taking care of the people behind you that come on later. We are public servants, and we take it very seriously. So please provide us with feedback. Let us know how we're doing. If we're doing great, tell a friend. If we're doing bad, tell me. Okay? We will always put you first, and we're always going to try and take care of you. Some of the billing questions, I am a little bit more familiar with the billing. The whole billing idea is to help sustain our department. It's to put the burden, and I hate the word burden, but it's to transfer the burden from everyone to the people who use the service the most. Now, one thing that we try, and if this is not correct, then let me know, because then I need to fix it, is we give you a means of asking for relief every time you get a bill. So you get a bill, they ask for your insurance, Medicare, Medicaid, all that insurance information, but then sometimes there's a portion there that's not left unpaid. And if that is a burden on you, then you need to let me know, because I can help you. So one of the problems that I see already as the new fire chief is that, 6 months, a year later, and there's outstanding balances on people's accounts. And it's the first I'm hearing of it. So when you get a bill and it's a problem for you, I'm a phone call away. And I will be proud to help you out. Again, going back, we're public servants. We're here to help you. So help me learn how to do that a little bit better, okay? Provide me with that feedback. Thank you for being proactive. Thank you for coming out today. Thank you to my expert over there. Brand new Deputy Chief Will Purcell in the back. He's been serving Lakeville for about 31 years? 31 years he's been here helping people. So I'm only one person. These guys have my back, and I'm better for it. So I thank them. All right.
And you know what we have also at the fire station is I make up some signs. I don't know if you saw it on our Facebook, but we have reflective signs that we can put on the mailbox Lakeville does not have streetlights, and sometimes late at night, it's hard to see the numbers, even if they're on the mailbox. It's hard to find them. So we have like one of those green rectangular signs that we put reflective stickers. You can see it from both sides of the road. And that's just one thing, is if we can't find you, we can't help you. So if that's just one more tool, we make them up. The association does have a charge for that, but in hardship cases, we've waived it before. So the best thing is we find you quicker, we can help you quicker. So that's just one thing to keep in mind. And that, we ended up doing an entire community just through our community outreach. Somebody came in for a burning permit, I talked to them, next thing you know, the whole street's got them. And what a difference it makes when you have somebody looking for a house, or if a mutual aid company came in. Some of the houses are a little wacky. You'll see 1, 3, 5. Some of them don't have a 1 and it starts at 2, and then there's no 4 and there's a 6. So if you have a number, it's easy to find. So thank you again, everybody.
Thank you.